So the patient population that we're going to be working with is a young adult whose name is Jack Fox, and he is training for a triathlon. Now, Jack is a 20-year-old freshman or sophomore in college. He was a former high school athlete where he did swimming competitively, and then for intramurals on the side, he played basketball and lacrosse for a very long time. He is a healthy individual, sitting around 6'2", 185 pounds. He's had no injury history in the past 5 years, as well as he has been working out for the past 6 months, doing full upper body, lower body, and back workouts, and has only recently, in the past around 2 weeks, started doing any endurance-based activities outside of basketball on the side, and he's only done running and swimming. He has not started biking, and the swimming is kind of like how swim practices went, and his running has been starting off slow, doing only mile to a mile and a half runs. He wants to be able to compete in this Olympic triathlon out in California in around 5 months. That's the time we'll have with him. He has 5 goals that he wants to achieve. The first goal is he wants to be able to swim 1,500 meters in around 20 minutes. 1,500 meters is around the distance that he'll have to swim for the triathlon, and this is not something that's going to be difficult for him, like do the long distance swimming. The time is what we're going to try and achieve, because since he's a former athlete in swimming, we know that he's going to be able to get this done. His next goal he wants to achieve is strength. He wants to make sure he maintains all his body strength and actually increase more. So he wants to be working on his upper body and lower body strength throughout the entire 5 months that we were training with him. And this is also he wants to increase his muscular endurance and also his power as well. His next goal is for biking, and he wants to be able to bike around 19 miles per hour for the full duration of the Olympic triathlon, which is around 25.2 miles. He's been on the bike once, and he kind of realized that 19 miles per hour is a challenging goal, but something that he can find realistic in the next 5 months. His next goal is for running, and that is to be able to run a half marathon in around 2 hours. And although he does think this one's a bit of a stretch, we may have to fluctuate throughout. Running a half marathon in 2 hours is around a 9-minute mile pace. So that's something that's a little slower to him, as he usually runs like around an 8-minute mile. That's what he's comfortable with. So being able to slow down and build up that muscular endurance to run a half marathon in 2 hours is what he wants to do. Although this is more than the triathlon, that's 6.2. He wants to be able to increase his endurance with that. And then his last goal is to stay healthy. He wants to stay healthy throughout this whole entire 5 months of training, whether that be the shoulder, his knee, or his ankles, as those are the joints that we're going to be most worried about. Swimmer's shoulder is a common injury within swimmers that they can tend to, so we want to keep that healthy. His knee and ankle for running is what we're going to be worrying about next. A lot of Achilles injuries, and then also we want to look out for strains in his knee, because with that's the joints are primarily to be working on, especially swimming, the shoulder, and then running and biking, or we're working on the knee and the ankle joints. I've read he's had no past injuries in the past 5 years that are going to be affecting him within this training. And yeah, for our pre-screening exercises, I was going to do 4 tests, measuring his heart rate, his blood pressure. I do a PAR-Q test with him, and I also ask him questions about his physical activity and the intensity that he's doing in his training. I would ask him about his resting heart rate first, and I would measure this by either the carotid artery or the radial artery manually. And I want to do this to get an idea of how strong his heart is, and how much work it has to do for each beat. Blood pressure, I want to test this because I want to test the the amount of pressure that his blood putting up against his blood vessels. And I want to do this because this will help us determine any risk factors for any diseases. And this kind of goes along with the next test that I would have Jack do for the meeting, and that would be the PAR-Q test. And the PAR-Q test is a pre-screening activity, and this is just going to give us general ideas We'll ask questions about his blood pressure just to see if he's at any, if he has any risk factors for any diseases. Because before going into exercise, since it's hard, it's at a higher intensity, we want to make sure that he's not prone to getting any diseases such as cardiovascular disease, although he is pretty young, so we shouldn't be able to see that. And then the last screening test I would do is I would be asking questions about his amount of physical activity he does and the intensity he does. I want to get a good base understanding at where he's at currently, how many minutes he's putting in per week, as he did start 2 weeks ago with endurance tests, and if he continued with his strength training and resistance training as well. The intensity, I'm wanting to question it because I want to get a better idea of how hard he's working, or if like when he's running he's going at a really slow pace, because I don't want to throw him straight into the fire and do high interval training when he's not, So the next exercise, or the first exercise assessment that I would do, is a spirometry test. And a spirometry test is a test that will help me get a better idea of your total lung capacity and how healthy your lungs are. And I'm doing this test for the swimming aspect, as swimming, of course, you want to have a high total lung capacity for when you're breathing, because you're doing nice short inhale and exhaling breaths. And I want to understand how fast and how hard you can inhale and exhale. So a spirometry test is, I will have a device that's kind of like a tube-shaped structure that you would put in your mouth, and then at one point you'd inhale as much as you physically possibly can, and you would inhale until you have sucked out the last possible amount of air in your lungs, and then exhale. And exhale as much as possible, and we're aiming for around 6%, I'd say, or 6 seconds, sorry. And then we do it again, because we also want to test how quickly you can inhale and exhale, how fast, how hard, and that's what we're measuring. We want to measure the total amount of lung capacity that you possibly have, and how powerful you're able to do it, and how fast you're able to do it. And this will be a good assessment for us when trying to figure out for the swimming, and something we can look back at in around 6 to 8 weeks to see how much. So the next test that I will be performing will be a one rep max bench press. And although we are doing a triathlon and working on aerobic fitness, we still want to increase our muscle strength. And this is going to be important for all aspects of our triathlon. And the upper body one will be the bench press that I'll test. And that'll be important for the swimming, for the pole, as we want to increase our muscular endurance, we want to stay healthy, and as well as increase the strength. And then later I'll talk about any lower extremity exercises that will help for developing power, and same thing, muscular endurance for our bike and our run. So right now I'm going to demonstrate how to do the bench press. And so you'll lie flat on your back, put your thumbs on the grooves of the bench press, and then you're going to lift the bar straight up, and then go down to your chest, and then back up. It's a full elbow extension, and we're going to do this with the most amount of weight that you can do, and this will give us a better idea of your total upper body muscular strength. So the next test that we're going to be doing is a lower extremity Wingate all-out power test. And this test is going to test our anaerobic power and capacity. And although we are primarily working throughout our aerobic system, we still want to work out our anaerobic system and capacity. And this is going to be important to have in our legs, because things like the swim, when you're kicking, if you need to generate more power, especially towards the end of the swim, you want to have more. For the biking, if you slower down your pace in your miles per hour, or towards the finish, or even going up a hill, you need to generate a lot of power in your legs to get up. And then run, same thing, towards the end of the run, once you're trying to increase speed, you want to make sure you have enough power in your legs to get you through that. So I'm now going to demonstrate how this Wingate test would work. So you're going to be on the bike, and it's going to be a 30-second all-out test. And you hop on the bike, and then before the 30-second countdown starts, you will start pedaling and getting used to the speed, and then like a countdown, we'll say start pedaling as fast as you can, and for 10 seconds it'll be fine, and then as this little clip down here, at 10 seconds, it's going to put down 7.5% of your whole entire body weight, and the next 20 seconds will be hell, and it'll be very difficult. And then towards the end of that exercise, we would have a computer screen that will show up and will give us data on your total peak anaerobic power, which will tell us how much power you're able to generate in your legs, as well as your capacity, and tell us how long you can maintain a high power throughout a certain duration. So the next test that we'll be doing is a VO2 max test, and this is a direct measurement of the amount of oxygen consumption you have, and it will basically tell us how aerobically fit you are during a maximal bout of exercise, and in this case, we'd be doing it on a treadmill, so running. And this will also tell us your maximum heart rate, and we can use both the maximum heart rate and the VO2 max during our training. So if you want to run at a percentage of your maximum heart rate, we are going to be able to know what exactly that is. So how the test works. So you're going to be hooked up to a mask that's going to be around your nose and mouth, and it's going to be hooked up to this, which is called a metabolic cart, and it's going to have a tube on one side, and the other side's going to be open, and it's kind of be like a one-way valve. So you're going to breathe in through one way, and it's going to go into the tube and then feed into the cart and give us data. So we're also going to have a Garmin heart rate monitor on, and that's going to also tell the computer at certain points what your maximum heart rate was. So we would start on the treadmill, and we go at a little bit more of a comfortable pace, probably a little higher than that. So say 8. So if you started at 8 miles per hour on the treadmill, and every 2 minutes, you would increase the speed. So we go from 8 to 8.5 to 9. So 4 minutes, we're at 9 miles per hour, and constantly we're checking how well you were doing. And from that, we're going to use that reading for the next minutes until failure based on the incline. And every minute or 2 minutes, we're going to increase the incline based on how you are. So if you're kind of struggling, we'll just increase it once. But if you're doing all right, we may increase it a little bit more. And you're going to be doing this until complete failure. And that is the only way this test will work. You cannot hop off early, because we'll be able to see on a graph, we want to see a little bit of a plateau, and that peak is going to tell us what your peak VO2 max is and how aerobically fit you are. So you are going till failure until you cannot stop anymore, but still safe at the same time. So I'm now going to be talking about the exercise prescription that I'm going to be giving for Jack. And this is going to consist of a lot of interval training to try and build up strength and endurance to increase speed as well. So the first one that we're going to try is slow long distance running. Now this is going to be to try and increase our aerobic capacity. So for around 2 times a week, we're going to be doing longer runs. And since he already does have some training and endurance, we're going to do about an hour run at a low intensity, so at 65% of his maximum heart rate, and we will be able to find out his max heart rate after we do the VO2 test, or we can also do a percentage of his VO2 max as well. The next test that I'm going to be doing would be interval training with running. So now we're going to be doing interval training to try and increase his speed and try and make him run faster at longer distances. So we're gonna be doing fast interval training, and this is gonna be 1 time a week. So we're gonna have 1 long distance running and then 1 interval training. And this interval training will be around a 40-minute exercise. So to start, he's gonna go into a first 1 mile warm up to get everything loose at a nice, easy, steady pace. And then we're gonna go after that 2 minutes of going at a fast pace, and this is all about feel, but you kind of want to go around 90% of his maximum heart rate, and then slow it down back to 2 minutes, and this is going to be slower than your usual pace, trying to get your air back. And then you're going to do 10 sets of this. So 10 sets of this will take around 40 minutes, and then you add in a mile warm-up, so say his would probably be around 8 minutes, and then try his best to do it for a 5-minute cooldown. So this is going to be last around an hour, and this is going to help increase our paces in long distance and increase both our speed and endurance. The next exercise that I'm going to be giving is for swimming. Now we're going to swim 2 times a week, and again, this is piggybacking off the running, and 1 swim is going to be long distance at your normal comfortable pace, and he's going to be doing around 2,000 yards So we're gonna do 2,000 yards without stopping, and I'd say this is gonna take him around 35 to 40 minutes. This is again gonna help build endurance and prepare us for what eventually is gonna be the 1,500-yard swim during the triathlon. The next swim will be the interval training, and this interval training is gonna be 5 sets, and we're gonna do 300-yard swims. And so we'll do the 300 yards and then take around a 30-second to 1 minute break. So this would be enough time to get his heart rate back down for a little bit and be able to catch his breath in order to complete the next sets. And we're gonna be going at around race pace for this, which is we're aiming for around a minute and 5 seconds for every 100 yards. And also forgot to mention for the swim, we're gonna probably be going at like a minute 30, minute 45, which is what he's usually comfortable with, which is where you're not going to have too much of a struggle for at least the first 1,500 yards. So, but that and the interval training is both going to help build up speed, endurance, and strength as well. Moving on to the bike. When we're biking, we're doing the same thing 2 times a week. The first biking session is going to be a slow, longer bike ride. So we're going to be, to start off, probably with an hour, and then slowly increase from there. So once he's comfortable with an hour, move up to an hour and a half, and then for a progressive overload, we'll move up to 2 hours after that. And this is gonna be all at a moderate pace where, you know, you struggle. It's not a struggle, but it's challenging, but not challenging to where he's gonna wanna die. So this is gonna help build up our muscular endurance needed for the triathlon. The other biking that we'll do for the other week will be interval bike training. So we're gonna be doing 1 hour bike ride, and this is gonna be at a moderate to vigorous high intensity. And we're gonna mix this in with interval training in the middle. So how I would like to break it up is the first 30 minutes is at his normal pace, and then if he's doing an hour, the sooner we start the interval training, but if he's doing an hour and a half, we're gonna go for an hour at his moderate pace. And then the last 30 minutes is all gonna be interval training. And how we're gonna do it is we're gonna do 5 sets of 2-minute hard, interval sessions. And it's gonna be around 85 to 90% of his heart rate. We're doing this to build up more power in the legs and increase the speed to go longer distances. And this also kind of piggybacks into why we were doing the Wingate, and we wanted to test the power, because the biking is what's going to need the most power, probably between any of the 3 tests that he's going to be doing. The 7th workout that I want to prescribe is a brick workout. So a brick workout is a bike to run workout, and we do a brick workout to help get our legs used to the transition phase, because at first it is very rough. Your legs aren't used to going from a long distance bike to an immediate run. So this brick workout is just gonna be 1 time a week. So, and both are gonna be light sessions. So it's gonna be a light bike, so something that you're comfortable with, and then followed again by a comfortable pace running. So I'd like to do an hour bike, 30-minute run, both at good paces, help build up endurance and help get our body used to that transition phase. Now, of course, we need to incorporate strength training. So we're gonna be doing strength training 3 times a week, and one of the training sessions is gonna be for your lower body, one of them sessions is gonna be a push day. So these exercises can be stuff like bench press, push-ups, overhead press, lateral raises, 3 sets of 10, 70% of their 1 rep max, and then stuff like push-ups, or like if you're doing isometrics like planks, you're gonna be doing it until failure. The next workout session I'd like to do is a pull day, and this can be pull-ups, preacher curls, bicep curls, deadlifts, any of those exercises. Same thing, 70% of what his rep max would be, and 3 sets of 10. And then the final workout will be like a leg day. So we're gonna be doing exercises like leg press, squat, leg extensions, lunges, RDLs, Bulgarian squats, leg curl machine, all these. Same thing, 3 sets of 10, 70% of the 1 rep max. and we do want to be increasing our strength in our muscles, as it's going to help build endurance and also power as well. And also to stay healthy, that's also important. We want to continue to stay healthy, because that is one of the goals. And continue on that track, we have flexibility. He wants to stay flexible. He wants to stay healthy for the next 5 months, and flexibility is going to help that, getting our flexibility and mobility as well. So we were doing exercises probably 5 times a week, I'd say for around 30 minutes. Stuff like single leg raises, a seated hamstring stretch, a piriformis stretch, any like 90-90 shoulder stretches. We want to make sure we're getting both the upper and lower body, because a triathlon is a full body workout. So we want to make sure that we're stretching out these muscles and getting them used to being at that end range of motion. And the final exercise prescription I'm gonna give is core training. So this would be around kind of like 3 times a week as well, kind of just like at the end of the day or beginning of the day, however you want to break it up. This can be stuff like planks, flutter kicks, single leg crutches. Just having a strong core is important for the swimming portion and maintaining a healthy body. So to summarize everything that we're doing, in order to stay healthy, to get all his goals that he wants to be done for the triathlon. That's why we're doing certain exercise assessments, to be able to test, now and later, to see his improvement. And these exercise prescriptions are going to help work towards each and every single one of his goals.